Hi everybody, my name is Dr. Vargas and we're here at Lumina Vein and Aesthetic Institute in Windermere, Florida. We are a BTL aesthetic center and we are proud to offer all of BTL's technology, and today we're here to highlight EmFemme. I have Katie with me here and I'm just so grateful that she is willing to share her story. She's an actual patient that has gone through the treatment, so this is something that's not easy for anyone to do, to just be open about your experience and how this affects your life, and just be able to sit here, obviously gone through the treatment, and just be open about what the treatment entails and how this has changed her life in a very positive way. So this is the device. Essentially, it uses a technology of radiofrequency, and the goal with the treatment with radiofrequency is to increase the blood flow to the vaginal tissues and the pelvic floor. The idea is that by driving more blood flow to the vaginal tissues, we can stimulate the production of collagen and elastin, which are very important to tighten the structures, to increase lubrication, to change the sensitivity in a way where hopefully sexual intercourse is not as painful or not painful at all. So the other advantage of this treatment is that the fact that it uses radiofrequency and is not a laser or anything that affects the mucosa during the treatment, it essentially means that there's no downtime. So, with some of the other existing treatments, there was some downtime where you had to hold off on sexual intercourse for some time. This is something that is not necessary after Emfemme360. Some of the other things that make this technology far superior are, for example, the fact that it is very, very fast. So these are some of the applicators that we use. So there are two sizes, essentially. This is an intravaginal treatment, and it feels much like intravaginal ultrasound. I think we've all had that at some point. And so there's actually two sizes of this applicator that can be used depending on every patient. We're not all the same. And the fact that there's this ring that's going to work 360 degrees circumferentially, it means that we can treat the entire vaginal canal all at once and not have to spend more time treating quadrants, for example. It just makes it a very fast and comfortable treatment. The second part of the treatment is actually an external treatment, but this external applicator is going to deliver the same radiofrequency with the same goal of increasing the blood flow, to stimulate collagen, stimulate elastin, and then tighten the tissues. And so this applicator is used externally more in the vulva, the labia area, so that we can also stimulate that collagen and elastin, drive that increased blood flow, which is only gonna help with the tissues, and almost make them be more like they used to be when we were younger, before we went through surgery or any hormonal changes. With this device, the goal is to do 3 treatments, and we are going to do one of those treatments every week. And most patients feel a difference, sometimes even starting with one. But we definitely want to go through the entire cycle to make sure that we're getting the most out of it. So I'm, again, very, very grateful that you are here with us today and willing to share your journey and your experience. I know this is not easy. Unfortunately, this is a condition that's highly prevalent. Many women out there are living with pain and discomfort and are just miserable, both from a physical and a psychological standpoint of pain, not being able to have that interaction with their spouses, their partners. And so this is an invitation for any of you who may be struggling with symptoms of pain, of aching, of just not being happy, to come, to call, to make an appointment. Obviously, everything is very confidential, and we'll be happy to explain everything in detail and hopefully be able to change your life for better.